of shared use facilities in 4 target counties: Bell, Clay, Knox, and Jackson. We did undertake a baseline assessment across all 8 counties, and then other organizations had looked across Kentucky to see if there were any existing shared use agreements. There were not any formal shared use agreements. If we think back to the diagram that Mikaela showed, there weren't any formal agreements. However, many of the schools did have sort of community access agreements or contracts that were fee-based, and people were able to utilize school facilities for events and other things like that. Almost all of them did require, of course, insurance, and that was a big issue that we encountered moving forward. In general, I would say the schools were relatively aware of shared use agreements, more so than the local government, and definitely more so than just the community at large. So our high-level strategy starting out the very beginning was to really put a lot of emphasis then on awareness raising, to leverage the existing partnerships that we had through STHA across many different sectors, to educate people on what shared use was and what the benefits of it were as well. And we were fortunate to have, in most of the counties, existing and very active multi-stakeholder county health coalitions that were definitely key partners in this whole process. We then thought we would be able to gauge interest of the specific parties that could potentially be partners in a shared use agreement and bring them together, and then identify locations, conduct joint facility assessments, sign agreements, promote, and evaluate. Of course, as you can imagine, at the gauging interest in bringing people together moment is where we encountered a lot of our barriers, and where some of the discussions actually didn't get beyond, or some of the activity didn't get beyond this point. At this point, we also realized that instead of having this sort of overall strategy, we really had to look at each county separately and understand the context and the concerns and opportunities that were available in those specific counties, and sort of treat them separately. This is just one example of an infographic that we put together mostly for potential stakeholders to kind of raise awareness on shared use. So this side shows the statistics, health statistics in Kentucky and the Cumberland Valley region, and then sort of an explanation of what shared use is, the roles of different potential partners, and what the benefits could be across health, education, economic, and community. So just to quickly go through the challenges, I imagine many of these are familiar for many of you. The primary obstacle and the area where we, some discussions just halted completely, was around the issue of liability. Kentucky actually does have some legislation that extends the same liability that schools have during the school day to after school hours. However, despite that, for some of the schools, this was an issue that we weren't going to be able to get around. Of course, vandalism, by opening the facilities and off-school hours, schools were concerned with vandalism. There is a high methamphetamine problem in the area, so people were concerned about the facilities being used for other things than physical activity. You know, as I mentioned, it is an area with high poverty and high unemployment, so there were limited resources to invest in upgrading facilities, and quite a few of the facilities needed to be upgraded in order to address some of the liability concerns, things like lighting or just equipment that had fallen into disrepair. And then within that context, making shared use agreements a priority within, you know, multiple and pressing needs and multiple projects or activities that could be undertaken to address health concerns in the community. One obstacle that we faced that we didn't anticipate was sort of some political or like historical issues with between the potential parties or to an agreement. In one county, there had been some recent, in recent memory, some issues on the county government side, and the school did not sort of want to be seen as too close, or too close to the county. They thought sort of politically it wasn't a good idea. So just some interesting challenges that we didn't anticipate. And the other one was time. We had about 18 months from when we started the awareness raising to the end of our grant period. In some cases this was sufficient, but I think if we had had more time, we would have been able to make even further progress. So in Bell County, it was, I would say, our greatest success. The county judge executive, so we have county and city schools in these counties. So in this case, it was the county judge executive and the county board of education that came together to sign a formal shared use agreement. And in doing so, they opened 3 facilities to the public at the Bell County High School, the track and the softball field, and then a mountain trail that had not been in use for quite a number of years. The county agreed to clear and renovate the mountain trail. They provided financial support and actually other support for lengthening the walking track, and they installed lighting throughout the 3 facilities. The Board of Education agreed to provide maintenance staff and to open the gates during the agreed upon public access hours. So we created specific public access hours in order for them to be able to budget appropriately for maintenance staff. They agreed to maintain the property and contribute to improvements of the walking track and the softball field. So this is just some photos of the before. On the left-hand side is you see that the mountain trail in the background there by the truck. There was no sort of paved walkway there, and you see there was quite a bit of trash and just it hadn't been maintained in quite a long time. We had actually produced a great little video, but I guess a GoToWebinar won't support it, but I think Mikaela will send the link after. So as you can see, this is after. There was some good signage that was also put up, the paved way to the mountain trail, and also some signage on the fitness track. In Knox County, it was, again, the county judge executive that was more receptive to an agreement, and the Board of Education, and again focused on one specific school. This was DeWitt Elementary School. They did not have a walking track. They just sort of had a space and an area for it, but not a formal walking track, and really wanted that. So the county agreed to build the walking track, and DeWitt agreed to open the facility every day, as well as open the gymnasium during the winter months and during the summer months for basketball leagues and other activities like that. The Knox County agreement was signed very close to the end of our grant period, so we weren't able to actually do an evaluation of that, but I do know that the walking track was built and is being used. Some of the key contributing factors, and I would say lessons that we learned through this process, one was the support of the health coalition. So having existing multi-stakeholder health coalitions in the county that had undertaken activities in the past together was hugely important. The various actors, from the Parks Department to transportation, across sectors sort of already understood their role in contributing to health, and I think that really helped in having a basis for understanding what their role could be in something like shared use and why that would be important. The local health departments in the counties that we worked in have existing very strong relationships with local government and with the school system, so obviously that was hugely important just for initial access and getting enough face time to be able to educate people and sort of advocate for shared use. The 2 schools where we were ultimately successful also had school administration and teachers and principals that were huge advocates, and I think that was critical to the success. We did initially have this idea that we could start with sort of a county level policy across all schools, and we sort of had to become more realistic and really focus in on one school and having success there and letting that be a foundation sort of for future growth in this area. I think, of course, the successes and contributions of other Spread the Health Appalachia activities and other local health department projects help people believe that we could be successful in this area as well. And then we did do a lot of awareness raising and promotion and just health communication efforts. And then, of course, we did have some financial resources from our CTG grant that were important in us being successful. We did two evaluations. We used two instruments for evaluation. So one is the SOPARC. It's the System for Observing Play and Recreation in Communities. And then we also, our evaluation team created an intercept survey to just sort of get people's opinions. So beyond the primary success of formally opening 4 facilities at 2 schools in 2 counties, reaching nearly 50,000 people, we did also see that that shared use agreements have great potential for increasing accessibility to recreation and physical activity opportunities. We did see that use of the facilities increased, and again, this is just in Bell County, increased during the program period. And the survey participants attributed this to the extended hours that they had in the new facilities that they now had access to. We saw an increase in, as you see, a 47%, a 60% increase, a self-reported increase in physical activity as a result of shared use. And people were, 90% of people were either very satisfied or extremely satisfied with having these new facilities in their communities. So I know I ran through that very quickly, and I will end there and be available, of course, for questions at the end. Thank you.
Thank you so much, Hitomi. We really appreciate you, your presentation and what you're able to share about your challenges and successes. So exciting to see those efforts move forward. And again, feel free for all of you on the call to type in your questions in the chat box. We will get to them towards the end of this webinar for more question and discussion. I'm going to introduce our next speaker. Our next speaker is Fahina Tavake-Pasi. Again, she is the Executive Director of the National Tongan American Society. Her leadership provides programs and access to opportunities to thousands of Pacific Islanders in Utah to healthier lifestyles, increased civic engagement, citizenship assistance, higher education, social justice efforts, and cultural preservation. Fahina has received multiple awards, leadership awards from Utah's government, such as Woman of the Year, the Salt Lake Leadership Award, Organization of Chinese Association, and from National Organization Leadership Education Asian Pacific Leadership Award, among many others. We're really pleased to have Fahina here with us today. And Fahina, I'm turning it over to you, and I'll be advancing your slides.
Thank you, Mikaela. I'll just say next when it's time to go to the next one. But thank you and welcome everybody, and thank you for participating in this webinar this morning. I'm going to talk a little bit about what we did here in Utah, and I wanted to first of all, that first slide, give a recognition to a very important part of the people that we're working with to make all these things possible, which was basically the Utah Pacific Islander Health Coalition, the Mizazi Life, also here, which is a Zumba coalition here in Utah. And then, of course, not mentioned here, our funder, which will be mentioned later, the Asian Pacific Islander American Health Forum. Okay, next. First of all, I wanted to talk a little bit about, just to kind of give you a brief overview of what the National Policy and Legacy and Legal Analysis Network define, how they define joint use agreement. Basically a formal agreement between 2 organizations or government entities or what have you to use a facility when it is not currently used for what its main purpose was for. And then, of course, the joint use agreement is used to can play at the bottom there a very important role in increasing the activity of our communities. Next. Just a little brief overview of Pacific Islanders in Utah. We have approximately 40,000 people here in Utah, with over half of them living in one county, which is Salt Lake County. And 2 of these cities, Salt Lake City and West Valley City, are part of Utah County. And they have the 2nd and largest Tongan population in the U.S. And they also have the 4th largest Samoan population in the U.S. So very large Islander population. Our health issues here in Utah, as far as Pacific Islanders, we are #1 in obesity in Utah. We also have rate #1 in infant mortality. We have one of the highest rates of diabetes, and including we also have one of the highest rate of cholesterol, cardiovascular disease, and various of other things. So we're, I think our eating habits and the things that we do here in America versus what we typically used to do back in the islands conflict each other, and so therefore a lot of this health issues arise. Next. And of course, this is not just among us. It's well known in Utah that we do have a very, we have lots of health issues as far as Pacific Islanders. Next. In our environment assessment, what we did, we acknowledged the fact that oftentimes ethnic communities or ethnic communities or communities with low population, even though we have a huge number here, we're only like 1.5% of Utah's population. So oftentimes our numbers, our data, we don't have data that we can work off that help us. And of course, data is the language that not only get us funding to help our issues, our health issues, but data also can tell us where we need to concentrate. So we went ahead and in 2010 with the Utah Health Department and implemented our own environmental assessment about what was happening in our community. So we had like over 600 surveys amongst our people, and these were some of the things that we had asked, some of the questions. You know, if people see people jogging, if they felt safe in walking and doing things in their communities or in their neighborhoods. Also about, you know, what is the cost and if that affects any of those things. And so, and from that we found that, next slide please, we found that in unfavorable environments that actually the activity or the physical activity is much less. Whereas if you live in an environment or a neighborhood that has lights and sidewalks and things of that type, the activities or physical activity tend to be much higher. Next. In addition to that, there were some other things that that were problems that were identified. Basically, the access. So first of all, the unsafe area. Also, there's cultural barriers that they also identified. Language barriers, not understanding a few things. Poverty was an issue. Low walkability access, and the high cost of rec centers, or just high cost of joining a gym. Kind of excluded many of our Pacific Islanders from participating in activities that would help them be healthy. Next slide. These were some barriers that barriers to physical activity that some of our youth mentioned. Lack of self-discipline was one, lack of energy, lack of interest, lack of company, and lack of time and distance, and then also the same thing, unsafe location. Of course, some of these things here are cultural things that if people did not understand, for example, lack of company. We come from, most Tongans or Pacific Islanders come from a very communal society, and so everything, well not everything, but most everything is done in a communal setting, and so that kind of has a tendency to encourage people to, you know, so those are some others there. So then we decided after we've gotten these surveys what we wanted to do, how can we increase our physical activities. And so, of course, like I said earlier, we were able to identify some a funder. So our funder was the Asian Pacific Islander American Health Forum from California, and then of course the National Tongan American Society of the grantee. And then we had a coalition here in Utah called the Utah Pacific Islander Health Coalition, which made up of a bunch of different organizations, Pacific Islander organizations. So we came together as a partner to start addressing this. We also had, sorry, next slide. So the grant that we were able to get was titled the STRIVE grant. So it's a STRIVE grant from the health. And so its main purpose was to increase the opportunity for our communities to implement high impact, population-wide, evidence-based strategies that would help physical activity, which is what we did focus on. We didn't focus on poor nutrition, we focused on physical activity and hopefully weight loss. And then of course the involvement, one of the things that was very important was the involvement of the community in this action plan, thus the Utah Pacific Islander Health Coalition. Next please. And then with that grant given to us, we decided as National Tongan American Society, this is what we were going to do. We identified the use of joint use agreements as one of probably the best way, because then it could go in many of the different areas where our Pacific Islanders resided. So we decided that we wanted to get 10 joint use agreements in place and then try to reach at least 75% of our Pacific Islanders in Salt Lake County. Next step, next please. So then what we did do is we received guidance from Health Forum and technical assistance from them, and also from the Utah Department of Health on many of the things as we started. We identified professor at the University of Utah who had some experience with the joint use agreement, we worked with them. We also saw the people from churches and people from schools that were able to assist, that would be able to help us identify churches and schools. Next. More of steps. One of the things that we decided we needed to do in order to get people on board was we developed a presentation on the importance of what joint use agreement could do to better the health of Pacific Islanders. So we had that, and we used that as we addressed people in churches and in schools. We also recognized that we had an issue with liability, because that was one of the problems that a lot of people identified as an issue from the churches and from the schools. They were afraid of the liability that would. So we worked with Change Lab Solution, which is they focus and they're specialized in joint use agreement. They're an excellent organization that have a lot of legal expertise in joint use agreements. So we worked with them to help us with our joint use agreements. And then, of course, as we talked to people, we found out that most of them felt more, our churches and our schools felt more comfortable with using MOUs instead of joint use agreement, because joint use agreement seemed to be too technical, and they felt more comfortable. So most of our stuff was MOUs, allowing us to use their venues. And then also just the shared health, just sharing that throughout the identity, throughout the community. Also, one of the things that we had to do was to identify people who made true, in order for time, because we spent a lot of time talking to people that didn't make the real decision. So that was one of the things that we needed to do, is identify the key people that could make the decision. We also have a weekly radio show here in Utah, in our organization hosts that, and so that was a benefit for us to get the word out, and then also the use of billboard and getting billboard and social media on board. Okay, next step. One of the things that we used to, or next slide, sorry. One of the things that we used to do with our, or that we did was with our coalition, was to identify the zip codes of where our Pacific Islander population resided, and this helped us to gather our numbers. Because we went back to our funder and say, how are we going to count how many were affected? So the CDC came back and said, use your zip codes, and that would be the area that you are able to, you can count that as your number that you are able to reach. Also, next slide, we have our weekly meetings are very effective to keep things on going and moving forward. Next slide. And this is just a picture here of one of our folks that signed one of our MOUs and one of our coalition members. Next slide. And then, of course, most of our activities, our joint use agreements, our shared facilities are in schools and churches, mostly churches. And in these places, next slide, they provide places to walk safely for many of our communities, and usually it's pretty much open to everybody. Next slide. And then in the facilities, we have safe and free indoor facilities that are available mostly in the churches. Next. And here are some of the outcomes. We were able to sign up 12 joint use agreements. We also reached 13,912 Pacific Islanders. Our target was 16,800. But we met our target, you know, even though some of those, because a lot of our people came from zip code areas that did not tie into the zip codes that we identified, but they were like further away. And most of our people actually do Zumba, so Zumba is really huge. Currently, we have 10 churches right now that run Zumba classes, and yesterday the Salt Lake County just released a report on the rate of physical activity of the different ethnic groups, and it was really strange. Something had really happened. We had 36% of Pacific Islanders are doing physical activity, and which is like, we were like really one of the lowest. And now we're highest amongst all of the ethnic groups, which was really interesting. And I really think that it's probably part of the Zumba classes that we have throughout the churches. Next slide. Here are some of the things that worked. Starting with people who already knew the churches and schools. It's really important to identify people who knew new people so that they can hook you up. Also, optimizing the existing partnerships with the University of Utah department. Also, establishing the less formal approaches using MOUs. Also understanding the Polynesian Pacific Islander culture, that was very important. And okay, next slide. Here are some of the challenges. The steep learning curve for JUAs, many people did not know what JUAs were, so we needed to work with them and helping them to understand what JUAs were. Identify the right people, and then the fear, the challenges. I think the biggest challenge was the liability issue. Next slide. And of course, we did a closing survey of our coalition members, and these are some of the things that they felt was very important. That the JUAs increase access to local facilities. That was a definite for sure. The process of planning and negotiating was empowering to the coalition. Also, that the Project Profit Coalition should develop agreements with new organizations. So we have more people joining the coalition. Also, and last, but the fostering and coordinating among diverse Pacific Islander organizations. And here are some of the lessons learned. Liability, we went over that. The engaging the attorneys from Change Lab Solutions was an excellent part of this. And changing the JUA to MOU and weekly meetings. And unexpected return, the coalition group became more empowered, including a member of one of the representatives from our Utah legislature also became a member of our coalition. Sustainability issues, like I said, when we started we had 5 Zumba classes, now we have 10 and working, and we have more people that continue to do this. We had the picture of our billboards that we had advertising our Zumba classes, and also the website that they can go into to identify which church group would be close to them to come and attend. Like I said, we continue. Right now, that particular grant ended, but we do have a grant with the Utah Department of Health Cancer Department, and that helps us to also continue get more churches. In fact, just the past month, we signed on 2 more churches for Zumba classes as joint use agreements. And that's it.
Thank you so much, Fahina. We really appreciate your efforts there in Salt Lake City, Utah, among the Pacific Islander community. So in the sake of time, I'm going to get to our next presenter, Teresa Wendell, who is the Neighborhood School Site Coordinator at Kiser, pre-K through 8, a public school in Dayton, Ohio. In her current role, she has brokered many community resources for the school and established 67 new partnerships, including businesses and faith-based organizations. She's developed a program at Kiser for the neighborhoods modeled after the Safe Routes to School initiative known as Panther Patrol. Teresa is going to speak to us about her experience at Kiser Elementary School in Dayton, Ohio. So I'm going to pull up her presentation. Teresa, you have your full time, and we will end with a couple of questions around 10:55.
Well, thank you. Greetings, everyone, from Dayton, Ohio. I'm kind of raspy a little bit. I've been struggling with the cold. It's been 60, 70 degrees in Dayton. Now it's going to go back to 20. So the kids are definitely sharing the love within the school. I just wanted to say thank you for this wonderful opportunity. The presenters before me, that is great information. And those that are listening, coming from Dayton, Ohio, it's great to know that folks want to play in the same sandbox. It isn't easy, believe me. I'm excited that the momentum across the United States with shared use is growing. A little bit about what it's like to be a neighborhood school and site coordinator. On slide 2 here, the purpose, you know, this has been, I'm not going to read it to you, but, you know, the whole purpose of a neighborhood school, and let me say, in the state of Ohio, we cannot call ourselves a community school. Community school in the state of Ohio is a charter school. And so that's why we have coined the term neighborhood school. And sometimes it does get confusing, but a neighborhood school is who we are in the public sector. There's several things I just want to highlight under the purpose is that young people are well prepared for adult roles in the workplace as parents and citizens. This is really important, especially the citizen part. The city of Dayton is known for an immigrant-friendly community with the Welcome Dayton initiative, and that has created a lot of challenges throughout the city, and particularly in the location where Kiser is located within this neighborhood, and I'll discuss more about that. The next slide kind of tells you a little bit about Kiser as a neighborhood school and our vision and our objectives. There's actually 5 neighborhood schools that started within Dayton Public School through the University of Dayton. I'm proud to say that we have brought Wright State University to be a part of this collaborative, and we added another school, Westwood School, within the urban core, and we hope to grow many others. What that really means is that you have a site coordinator, such as myself at Kiser. I have a 0 budget. I don't have any staff, and I have a lot of challenges to get people to play in the same sandbox, but that's what it will take for everyone to succeed. My role as a site coordinator at Kiser is not only a broker of relationships, but I also wear a community organizing hat as well. We have a very large development initiative, which I'm involved in. It's called the Da Vinci, which impacts our schools, and it also impacts the momentum of creating folks in the community to utilize the school as a neighborhood hub. So we're very excited about this new development. The next slide will tell you a little bit about our demographics at Kiser. We have a total of 577 students. And out of the 577 students, we have 174 ESL students. That's English as a second language. Our primary population is our Turkish community. And a little bit about the history of our Ahishka Turks is that they came from across from Turkey and Russia and settled in Old North Dayton, because Old North Dayton has a history of European immigrants back in its day. Right now we have over 300 families established within our community, and the challenges of language, which the previous speaker mentioned, I can relate, definitely. And we're excited about the millions of dollars that they have done surrounding the school in our neighborhood and renovating of houses. Now, actually, Kiser has 7 different languages. The population that has increased, which has been surprising this past school year. I've been in this position for 6 years, but this past school year, we've had an increase of our African population. So I have kids from the Congolese, Rwandan, Eritrea, Somali. We're really getting those kids from Somalia and Eritrea because of the goings-on that's happening within their country, as well as their refugee camps really are getting full. So they're really trying to move them very quickly to the United States. With that said, when a refugee comes from across and lands in the country, our Family Catholic Social Services will greet them, get them established, and they have 2 weeks getting into a school system. I mean, imagine coming across the waters, not knowing what's going to happen, and being stuck in a school in 2 weeks. It's been really a blessing to see some of our kids to learn how to work a water fountain, seeing their first snowflake, but more importantly, being able to work with us for after-school programs as well as the parents. Now, what has happened is a lot of our organizations have graciously supported this transition here at Kiser and really want to be a part of it. We have a lot of faith-based organizations that reach out to our immigrant population after school and during school, but it's been really cool to see how the dynamics of the Christian organization and our Muslim population work hand in hand. Some folks said it couldn't be done. Well, it has been done, and we all can play in the same sandbox with the common goal of working with all families and all of our children. I have some slides coming up. For our next slide is our Trunk or Treat. It's a community initiative, and actually this has grown because of our Panther Patrol and the Safe Routes to School initiative. You know, because the neighborhood and the businesses started feeling more comfortable working with a public school, because there's been some animosity about not wanting to, I don't know, come into a school and participate or get to know how Kiser can be your neighborhood hub. So I started building relationships within the neighborhood, and it's a great trunk or treat. We do a fundraising of a haunted house, and actually what was really cool was as we were developing to see our Turkish kids dressed up in costumes. And there's a lot of, there's two different groups here in Dayton, especially in the Old North Dayton area of the Hishka Turks, and it's more of a value and a belief, which can become a challenge. I kind of look at them as old school versus new school, maybe Democrats and Republicans, but they all come together when we do have community events. The next slide will show you our Robotics Club. We have University of Dayton, and they come in as well as work with our kids and volunteers for our Robotics Club, which competes in local and regional initiatives. The slide after this is a walking audit. This walking audit, we had the Dayton Partnership, we had folks coming in, faith-based businesses, to walk the neighborhood to look at the pros and cons of creating safe routes for school. A lot of our neighbors now are Turkish, and so there was a development of trying to communicate with the population that it is safe to school, walk to school, and by this walking audit that we did with the City of Dayton and others, we were able to present it to the head of the Turkish community so they could then advocate to support us and the families to be able to walk to and from our school. YMCA Soccer for Success. I mean, I can't share enough about the YMCA with this health initiative. It's actually, you know, if you really want to put it in academic words, it's a nutrition science, because actually what they do, they use soccer to educate nutrition through this program. And nutrition, as like the previous speaker mentioned, is a challenge with some of the groups. I'm working with Children's Medical Center, which is a few blocks away from us, dealings with on nutrition, because as our kids are coming into our country, eating our school lunches, there is a challenge, and there's also a health concern. Now, we know that there's been some initiatives across the United States with changing the nutrition at public schools, thanks to Mrs. Obama with her initiative, but it goes even deeper, because these kids are, I mean, when they eat what we have, it is unlike anything that they had in their country. And then they get predisposed to the foods and the candies as they start becoming more Americanized and being more of a elementary kid and teenager, and they're really finding some serious obesity issues with some of these populations that they haven't noticed before. So this will be proceeding forward as we grow and as the initiative with Children's Medical Center grows as well. The next slide is our city folk. It's an actual organization that has implanted themselves within the school. It's more of our cultural initiative. We do cultural nights here where we would have 1 month, we would have Turkish foods and music and dance. The next month we would have Latino, and with all the foods that culture brings with music and dance. And we also will have, we had Korean night and then African night with all the different foods from the different countries within Africa. And it's been really a hit, but what really transpires from events like this, I get help. I get people interested of wanting to say, hey, Teresa, what can we do to help? And at an earlier slide, we have over 104 volunteers. Volunteers from different groups, faith-based, business, all over the place. And people are willing to help because they can really see where they can make an impact. My goal is to have 577 volunteers. I know the principal here thinks I'm crazy, but I at least have to put it out there because that's what we're about, bringing people in together to make that impact. The next slide is our Panther Patrol. Once again, I can't really thank the Safe Routes to School initiative. Our Panther Patrol has grown, and in the beginnings, it was very well planned and really tight. But as it has grown, and we now have our Turkish parents walking our kids to and from school because now they know that the routes are safe. They're familiar now because during this time there's been more international restaurants and stores have been developed in our neighborhoods. So the community's feeling more like it's more welcoming and more friendly. So when they go to and from school, you know, it's like the community's being more of them now, like the school. And it's been really neat to see develop over the last several years. And then,
Mikaela, I'm just giving you your warning. We're getting close to
time.
Oh, right.
Okay. And the last slide is Crayons to Classroom. They are a great partner as well as they do a lot of presentations and support here. So, you know, there's so much more that we can always share, but it's important to know it's hard work, but that's what it will take to make a difference in shared use. And thank you for everyone's time.
Thank you so much, Teresa. We truly appreciate your time and your efforts happening there in Dayton, Ohio with this school. I think, you know, what many of us will learn is that schools serve more than just the purpose of education, or they can serve more than just the purpose of education. While we understand that's their primary purpose, schools can truly be a center for community. So we want to take a couple of moments to open it up for questions. I think Molly did put in the chat box that if you're interested or need to want to listen to this information again, that the webinar will be available within 48 hours up on our website. So she sent that link in. So some of the questions I'm seeing are for Hitomi and also Fahina. Will some of the evaluation results be available that you've done? So can either of you ask those questions?
Yes, this is Fahina. What I'll do is I can send you all the evaluation or the outcomes of the survey, Mikaela, and then you can make that available.
Excellent, great. And then one person asked, is the judge executive equivalent to like a board of commissioners in other municipalities? Fahina, Hitomi, if you don't mind just explaining the role of the judge executive, county judge executive.
County judge executive, yeah, he's the head of the county fiscal court. So I assume that maybe that's equivalent to what you just asked.
Commissioner or a county supervisor, maybe?
Mm-hmm. Yes.
Yeah.
Okay. Excellent. And then one person also asked, Hitomi, is the shared use infographic you created available online somewhere?
It's not, but I'm happy to share it. It really is, I would say, a hodgepodge of many other materials that are out there on the internet, but I'm happy to share it, of course.
Okay, great. And then someone else asked, would the speaker share the joint use agreement criteria, the terms, sustainability, the cost of the agreements that were developed? For any of you guys who have done that, is that information you're willing to share with other groups?
Yeah, this is Fahina. What I could also send you, Mikaela, is kind of like just the basic MOU that we used. That was the Change Lab that helped us with that. So we can forward that, and if they want to use that, that's fine.
Okay, excellent. And then I will just say, as I get to kind of my closing slide, I just want to share that, we do have, resources here at the National Partnership, our Shared Use Clearinghouse, for those of you, even for our speakers who are who have information that they'd like to share for, like templates of your shared use agreements, research, evaluation, etc. We can add it to this clearinghouse. It is to be represented by all of the states. I update it with materials often, so, and even for those of our audience members on the call, feel free to send me directly any information that you have. My information can be found on our website too, my email address. So with that being said, we are at the top of the next hour. I want to thank each and every one of you who have attended this webinar. We really appreciate your time. Hope you've been inspired and have learned something and are thinking about shared use ambassadors in your own neighborhood. And lastly, I would like to thank each and every one of our speakers for taking the time out today and preparing your presentations and sharing your expertise. Thank you so much.
Thank you.